Welcome to Dr. Sanjoy Mukherjee's Be Positive channel. Hi, this is Dr. Sanjoy Mukherjee, and today we are going to understand depression in detail. What is depression? Usually, people feel depression is merely a feeling of sadness. No doubt, there is an element of sadness, but it is much more than that. In depression, there is a low feeling, low mood, low self esteem, low energy, what we call it as a lethargic feeling. There is poor concentration also, and loss of interest in normally enjoyable activities. Moreover, there is also a disturbance in sleep patterns as well as in appetite. So, there is a change in appetite or sleep patterns. So, these are the basic symptoms required to be called as depression. So, let's look into what are the different types of depressive disorders. This is basically for doctors, not for the general public, but very briefly, I will touch upon it just for knowledge. Okay, and then we will look into the main ones. So, there are various types of depressive disorders, starting with what we call it as a major depressive disorder, MDD. Then there is dysthymia. Dysthymia is also known as PDD. PDD means persistent depressive disorder. Then very common thing, PMS, premenstrual syndrome. Then PPD, postpartum depression, that is after the delivery, which normally happens. Then there is something called SAD. SAD means seasonal affective disorder. This is usually happens in winters. And then there are few more also, like psychotic depression, which is very different. In psychotic depression, there is an element of delusion and hallucination. So this is not the normal depression then, where medications are also required. Then we have bipolar depression or a bipolar disorder. It's also known as manic depression, bipolar. Because most of the other depressions are unipolar. You feel low. Here, at times you feel high, very high. That is mania. And then you feel low also. So that is depression. So bipolar, there are two poles, not only one pole, that is depression. So these are the various types of depressive disorders. Now coming back to the two main ones, the first two, the most common ones in depressive disorders which people suffer from, the first one is major depressive disorder, MDD, which usually we call it as a depression, where people have to go to, they say, to psychiatrist to start with medication and then come down to psychotherapy or counseling, because medicines can always bring you to moderate level. It cannot actually cure you, to be very honest, but it is the psychotherapy, proper counseling, which will bring you from moderate depression to normal life. So anyway, that we will look into some other time. So here, major depressive disorder or major depression, here you have to be at least for 2 weeks. It can be counted as major depressive disorder when you are suffering from disorder at least for 2 weeks. And it is a very high level of depression where you're almost non-functional. You don't feel like doing anything. You don't feel like going to work or do much things and all. Long back I have talked about, like, there are 3 levels, I think in my earlier video only: mild, moderate and major. So mild, anyone can suffer for a few days to maybe a week max. Moderate is when you feel disturbed, and major is more than 2 weeks at least if you are suffering and you are almost non-functional. You are not doing those things which usually you should be doing, like your work or enjoyment, playing or whatever. So you don't feel like doing, you lose interest in that, and you feel you are not good enough. So these are the symptoms of major depressive disorder, but it can be only said when it is more than 2 weeks, and it is very strong. Whereas in dysthymia, that is the other type of depression, the second common, which is also known as persistent depressive disorder, PDD. So this one is longer period. Here instead of 2 weeks, it has to be for more than 2 years. However, this is not very strong one. It is quite to the moderate level where people are in depression but they keep on doing their work. They feel always low in their life. They don't feel good about themselves and they are not okay. But they keep on doing their work. At times they may enjoy also, but there is not a happy feeling in their life. So we have MDD, major depressive disorder, and PDD. PDD is the persistent depressive disorder, which is the other name for dysthymia. Dysthymia was the earlier name. Now people call it, psychologists and everybody, they call it as PDD. Okay, so these are the major depressive disorders. Now let's look into what are the causes or causative factors of depression. A lot of doctors feel that depression is a personality problem. It is caused due to personality. If you ask me, what is personality? It's a combination of nature and nurture. Now, what is nature? Nature is the way we are wired, the genetic factor, the hereditary factor. And nurture is the way we have been brought up. Right from our childhood experiences, that can be a lot of, traumatic experiences also, or painful experiences, events, incidents in our life. So this is a combination of nature and nurture. Besides that, there can be a lot of other life events also, traumatic events also, incidents also, like someone's death or losing somebody or losing so-called job or money or so many factors, life events, what we call it. Apart from that, there can be health issues, then medication, which also can give rise to depression or drug abuse. So there are so many factors also. But majorly, people feel it is genetic factor and the life events. But let me tell you, the major causative factor of depression is your mind, the way you think. It is not just an incident or experiences which gives you depression. It is what you think about that incident, those experiences, which gives you depression. It is not what happens to you in your life that makes a difference. It is what you do with what happens to you that makes a difference in your life. So it is your mind, the thoughts. I would recommend here to see my video on mind over matter, which talks about how your mind or your thoughts give rise to chemical changes in your brain and then the body and all those stuff. So major factor is your mind, no matter whether it is genetic or life events, incidents or whatever. Regarding causative factors of depression, one more point I will take over here, and that is a lot of my doctor friends ask me when I talk about mind causes depression and your only thoughts. So they ask me, then what is the difference between exogenous and endogenous depression? See, I am taking this point because it is very important for all of us to understand this particular element. So please pay attention and I'll explain to you exogenous and endogenous. Exogenous depression is also known as reactive depression. It means there is some reason for depression. Something has happened in life, major thing. Like as I said, some life event, some loss. It could be loss of a person, loss of a loved one, heartbreak or a death, or it could be loss of a job or big amount of money or whatever. So there is some reason. So which has given rise to depression. Endogenous is, according to medical doctors, that there are no reason. The only reason is chemical change or chemical imbalance. Okay, so this is what they feel. Endogenous means there is a chemical imbalance. In exogenous, endogenous means internal, something to do with inside. And exogenous means external, reactive. There is some external factor which has given rise to this. Now let me explain to you In both the cases, there are chemical reactions or chemical changes. Neurotransmitter, there are imbalance of neurotransmitters, biochemicals. In both the cases. First case, because of this exogenous, reactive, some loss, you start thinking negative and you feel you are doomed or whatever, and there is a chemical change in your brain. In the second case, we feel there is no reason, but even there are reasons. There are small reasons. Life things which is happening not according to what you want. You feel life is not worth it, or you feel you are not worth it. There is an element of worthlessness, hopelessness, helplessness. So there is something called low self-esteem, and you are not enjoying life. When you don't feel good about yourself, you don't feel good about life, and this gives rise to the chemical changes. But there is no major factor. So medical doctors feel that there is no reason, but just a chemical change. Chemical changes are there in both the cases, whether reactive, that is exogenous, or endogenous. And there are reasons also in both the cases. In reactive, there are big reasons, major reasons, obvious reasons. In the other one, endogenous, there is no obvious reasons. There are no evident reasons. But small things are happening at the back of your mind, in your life, which gives you depression. So that's what I just wanted to cover. And finally, let's look into some of the treatments available for depression. Scientifically speaking, there are two major forms of treatment available for depression. One is the psychiatric treatment, that is with medication, medicines, as we call it, antidepressants. So, by using antidepressants, psychiatrists treat depression. And the other form is by psychotherapists or psychologists. They use psychotherapy, counseling and psychotherapy, which is more of a drug-free treatment. I mean, there are various kinds of psychotherapies like cognitive therapy, behavioral therapy, or a combination of cognitive behavioral therapy, which is also known as CBT. I use more of eclectic. There are various kinds of psychotherapy, a combination of that. As a matter of fact, I have developed a drug-free treatment program of depression, which is basically based on psychotherapy. But there are so many other elements are also included. We can call that treatment program as depression treatment without medicines. In my subsequent video, you will be able to find that. So for now, thank you so much and be happy.